Okay, well, we're just past noon, so it's a great pleasure to welcome everybody to this NHRP Lightning Talk session entitled How Can the NHRP Academy Support You? And I think we're going to move through some of that and go beyond that in a little while. For those who don't know me, I'm Quentin Anstey. I'm the Pro Vice Chancellor for the Faculty of Medical Sciences and Director of the NHRP. It's a real pleasure to welcome everybody to this meeting. So we have two speakers, I think, today. I think Amy Brown from the NHRP Academy is going to kick off. And then after that, Dr. Sarah Sowden from the Public Health Sciences Institute, who's a senior lecturer and a consultant in public health, is going to follow on from there. So without further ado, Amy, over to you. Thanks very much indeed.
Thank you, Quentin. Hello everyone, so I'm Amy and I manage Newcastle Health Research Partnership Academy, and we are really here as the career development arm of our partnership, and we are very inclusive and we support health and care academic careers of our most promising leaders across disciplines and backgrounds, and we do that by really relying on a lot of the expertise that we have around us and by having a real person-centered approach. I always like to make it very clear that we are real and we do actually exist. We are a team. So we have an office, and if you're in Newcastle or on Newcastle University campus, you are very welcome to come and join us. We have hot desking space and very much an open door, and we've got sofas, tea and coffee, and if you come on a good day, we've got biscuits, and you are all very welcome. Next slide, please, Claire. So we work in partnership, and we work in partnership across our region. So yes, the N in NHRP stands for Newcastle, but please do take that as a legacy, and we work in partnership. These are our partners down the bottom, and as far as I'm concerned in the Academy, if you have one foot in one of these camps, then you're very much part of our community. And for a lot of the programs that we support, they genuinely are across the region, and Sarah's going to cover some of those as well. So if you think you're in the club, you most definitely are. And we work across universities, other organisations, the local authorities, NHS trusts, and we're here to help you get from where you are now in your research career to where you want to be. Next slide, please. So we refer to pillars in our academy, and when we talk about pillars, what we mean really is for professional groupings, if you like. And the reason that we have professional groupings is that people's careers, depending on their professions, look different, and also the opportunities that are open to people have historically been dependent on the profession that people are in. So it's not to sort of put people into boxes, it's really to help build communities and help you navigate to where you want to be. So we support medics and dentists, we support nurses, midwives, allied health professionals, pharmacists and healthcare scientists, research methodologists, which are essential to everything, and public health and social care professionals and researchers. Claire? And we support people along the full training pathway. And this is just a way of trying to illustrate the pathway. This is not supposed to be an illustration of what somebody's career looks like. Nobody's career goes in such a simple, direct way, and that's why I always put a messy ball of wool at the bottom to show this isn't somebody's career, this is the training pathway that we support. And we support people from the undergraduate stage right the way through to route to independence, higher level fellowships and the professorship level. And we do that for all of the professions that I mentioned in the previous slide, and we do that in various ways, and we're involved in lots of different programs, and I believe Sarah might be talking a bit later about some of the newer programs that we've brought in that specifically target that undergraduate and pre-doctoral internship start phase. And in Newcastle, we really like to focus on that pull-through, and when we talk about pull-through, what we mean is getting to know who our people are and what the opportunities in our region are, so that we can help people navigate from one step to the other and pull you along through your career from where you are to where you want to be. And I realise that is different for everyone. How can you get involved with us? Well, there's lots of different ways. So we have a Fellows Forum, which is really there as a peer-to-peer support network. We have put training sessions on, which have been designed by you, our community, and we put those on to help bring professions together at different career stages and across professional boundaries. We also have a pre-doctoral community and a post-doctoral community, both of which are regional, just so that people can get together and realise they're not alone and they can help get support from their peers at that stage. We run Know Your Funder sessions, which are really helpful sessions and crucial in helping you get under the skin of what the funding scheme you might apply to is. So we get in touch with a panel member or a chair, and we ask them to come and give us an online talk about a particular scheme so that you can get insights and ask questions about a particular scheme. The most recent one we did was the development the DSE Award, the Development Skills Enhancement Award, and that's available on our YouTube channel, and they really are very useful sessions, so please do log into those. And we have a lot of one-to-one career conversations as well, so that we can understand what you as an individual need and help you decide how to get to the next stage. All events are on our website. If they're there, they're open for you and you're welcome to join them. And if you'd like to join any of our pillar mailing lists, there's a QR code there as well. So please just get involved and see how we can help you. I'm going to pass you on now to Sarah, I believe. That's my last slide. Yep.
Lovely, thank you, Amy. And it's a pleasure to be here today to talk about public health. My name is Sarah Sowden. I'm a senior clinical lecturer here at Newcastle University, undertake a programme of research around health and care inequalities. I'm also have the great pleasure of being the Newcastle Health Research Partnership Academy's co-lead for Public Health and Social Care pillar. I wear a hat as the Deputy Director of the NIHR's Research Support Service Specialty Centre for Public Health, more of which in a few moments. And I also work on the ground as a public health consultant within the Office for Health Improvement and Disparities. So in terms of public health, I thought it'd be a good idea just to take a zoom step back and just look at the landscape ahead of us. So next slide, please. The landscape that we see before us is one of late, recently stalling, if not falling, life expectancy. Things have recovered to some degree since the pandemic, but we've had 5 years of basically flat mortality improvement, which is pretty poor by historical standards. Next slide, please. We also have a public health landscape which is increasingly divided. Health and care inequalities loom large. We've had austerity, COVID, and now the cost of living crisis. Next slide, please. Indeed, in the northeast, so the area that our partnership focuses on, we have some of the worst health outcomes, lowest levels of life expectancy and healthy life expectancy in the country. Next slide, please. No wonder we have health and care systems which are inundated and overwhelmed with demand. We do have first-rate healthcare services in this region, which we're very fortunate for, but we can't treat our way out of these issues. And indeed, that's something that our most recent piece of guidance by the Department of Health and Social Care, our 10-year plan for Health Plan for England that was launched in July this year, notes there's really three key shifts involved in this, from sickness to prevention, analog to digital, and hospital to community. And in terms of research, next slide, please, we really have a key role to play here in terms of our public health and social care community, in terms of answering this call about being strategically relevant for the future. Professor Sir Chris Whitty, CMO, has been really outspoken about the importance of public health research. And this is a photo from pre-pandemic when Professor Chris Whitty visited our region. This is a photograph down in Teesside with some of our colleagues working in health and care research, including public health. And Chris stated in 2017, research activity should go to the populations most affected and who most need it. And we would like to encourage the best researchers to undertake clinical and public health research in the areas of England with the greatest health needs. And that's really what Newcastle Health Research Partnership Academy is all about, growing that pipeline of people to address that call by the CMO. Next slide, please. So from a public health and indeed social care perspective, although I can speak less about social care because that's not my area of daily practice, but we do have mountains to climb and challenges to overcome in this space. In many ways, public health research landscape differs from clinical research, and that's speaking from the perspective of someone who has been on that journey as a clinical academic in public health. The majority of public health research is delivered outside of the NHS, and that workforce will sit beyond the NHS boundaries as well, in local government, in voluntary community and social enterprise sector, and indeed beyond. Much of our public health research is what you might call upstream prevention, and not necessarily clinical, but is of course of absolute relevance to the NHS, as our 10-year health plan shows us. The research we undertake in public health doesn't even necessarily involve recruiting participants, let alone patients. We do a lot of analysis, for example, of routine data or quasi-experimental methods research to evaluate the impact of policies such as smoking bans or alcohol minimum unit pricing. The culture for evidence-based practice isn't necessarily the same as it is in the NHS in other contexts. And from a workforce perspective, even though there may be great will and an enthusiasm to get involved in research, the operational sort of constraints on the ground, if you like, are such that, particularly in something like social care, there isn't always backfill and there isn't always the opportunity for people who are keen to do research to get involved. Next slide, please. So this is really where the health research, Newcastle Health Research Partnership Academy pillar for public health and social care really comes in, and I'm really delighted that it is such a big part of what we do as the Academy, as it's so crucial for our future health in the nation. Next slide, please. In this region that we have a lot of building blocks to build on, and in terms of growing research capability and capacity in public health and social care. Next slide, please. And as Amy was saying, we support people at all stages of their career journey. There's something there for everyone. And this is also in terms of achieving the level of research engagement that you wish to achieve for your particular career that you do. So some people, what's been right for them may be a champion of research or a user of research, through to people who want to pursue fully blown research careers as clinical academics, for example. So there's something there for everyone. Next slide, please. I mentioned at the outset the Specialist Centre for Public Health Research. So I'm really fortunate to be Deputy Director of the Specialist Centre delivered by Newcastle University and Partners, which is a £24 million investment by the NIHR into growing research capability and capacity nationally. I haven't got time today to go through the wealth of things that the centre is doing to support growth of research in this space, but I would encourage you all to click on the links to find out more and join the mailing list. For example, we provide a lot of support into local authorities around resourcing posts and positions for local government research. We have a really growing and diverse offering in training development, which interfaces very closely with what's done with the partnership as well. We've done a lot of support about research governance and ethics for research outside of NHS settings, and a really active community and public partnership in research engagement piece as well. The bread and butter of what the support service offers is research design advice. So just as Amy was saying, to reach out to the partnership in terms of speaking around if you're developing a research protocol, for example, the Specialist Centre for Public Health can also help in this space as well. Next slide, please. Amy was mentioning the really exciting new developments that we have in our region, and one of these is the Insights programme led by Professor Annette Hand. So there are 12 regional programmes and we are one of them. The NIHR's Academies has invested around £30 million into this area around supporting training and career development for health and social care professionals. And if you are UKPHR registered in public health or Social Work England registered in social care, this is also open to you. It's been a target around underrepresented professions, and really its aim is to attract more nurses, midwives and allied health professionals into a career in research. Yeah, next slide. So again, there's a wealth of information there, and I haven't got time to go through it all, but there's the links to find out more. There is lots of undergraduate students supported across 50 programmes. There's master's places funded through this programme for people to engage in, for example, the Public Health Masters at Newcastle University, loads of workshops, research seminars and other things, mentorship schemes. Next slide, please. We also have the internship programme. This is our newest offering, which is just launching, led by Professor Simon Hackett, and that is a internship programme with £10,000 available for support for people to get involved. And again, there's a QR code link to find out more about that, but another really exciting development, and great that our region has secured that. Next slide, please. The NHR Academy nationally offers awards, personal awards to support research career development at pre-doctoral, doctoral and postdoctoral award level, and they've recently simplified their offer, in their eyes at least. But nevertheless, it requires quite a lot of navigation to understand the different parts of this and where your particular research journey may fit in, and Amy and others at the partnership are on hand to support here. Next slide, please. And I'm just returning to this slide because at the back there is Scott Lloyd. Now, Scott is someone who I've had the pleasure of working as and supporting his public health career, research career development. He was very successful in getting one of the pre-doctoral NIHR local authority fellowships, and then through the support of the Academy now has a doctoral fellowship through the NIHR doing research around advertising of food in our civic spaces, for example at bus stops. So really great success story for the region. Next slide, please. There's also local authority short placement awards. Again, these are schemes worth up to £15,000 to undertake a bespoke short placement in research for people who are from local authority backgrounds. Again, haven't got time to go through all of this, but I guess what the aim of today is just to flag is that there's lots going on, and there's lots there that we can support you with. Next slide, please. I mentioned the Specialist Centre for Public Health. There's also recently been established an equivalent for social care. So if you're on the call today and social care is your background, there's also a specialist centre that offers support for people in this space as well. And again, details are there and will be shared afterwards. Next slide, please. Yes, so I really feel it's a great time of optimism and action for us all in the space of public health and social care research, and indeed more broadly in the Newcastle Health Research Partnership Academy. You know, just knowing the fantastic folk that I'm lucky to work around and the amazing breadth and depth of talent within our workforce, it really is a great place to be involved in research in health. And so we're all here to support you essentially in your journey, and I'm really looking forward to working with you if I don't know you already. So, and that's me done. Thank you.
Well, thank you very much indeed, Sarah and Amy, for that whistle-stop tour of some of the opportunities going on within the NHRP Academy and beyond that. I think one of the things I really reflected on, and Sarah, you brought this out, is that we're based in a region with incredible challenges, and this is a fantastic vehicle for us to start to work together to address some of those. So I think that's very useful. We've got a few minutes left, just 5 or 10 minutes. If there are any questions, I think, you know, either pop them in the chat or do just stick your hand up, because it would be great to hear what other people think, maybe hear about your own experiences of research, areas where perhaps it's been challenging getting into research, and where Sarah or Amy can point you in the right direction. So I'll give you a couple of minutes for that. But Sarah, whilst we're waiting for people to put questions into the chat. Maybe you could tell me, one of the things I think it's very important that NHRP in the wider sense is able to do is address some of the biggest challenges, and inequalities is a key area for that. What do you think are the areas where we have the greatest opportunity to come together, and potentially the funding streams as well, where individuals have the greatest opportunities to come together on that? Looks like we may have lost Sarah. Yeah, I don't know, Amy, if you can.
Sarah's frozen for me as well. We do a huge amount of research across the region in health inequalities. Two things I think that really spring to mind are the NIHR challenge areas that are currently being looked at. And so Newcastle is part of the Maternity Disparities Consortium. And Newcastle's actually leading on the capacity building side of that for the national consortium. That's Judith Rankin. And so that's a huge opportunity, I think, where there's actually money coming into the region or coming into that consortium. And so I think that's a really good place for us to be looking at and addressing inequalities and inequality research. The next, Sarah's sending her apologies. The next areas that are going to come from those challenges we know will be cardiovascular disease, mental health, respiratory diseases, and then also early diagnosis of cancer. And I think thinking that, the government's obviously identified those as their core 20+5 challenges. They're going to put money there. And I think really we should be looking as a region, especially as we have such a large mental health trust as well. I think there would be excellent areas. But I'm sure Sarah would have lots of other things to say as well, looking at her deep end research.
Yeah, thank you, Amy. Oh, we seem to be losing Sarah at a rate of knots. She was here a second ago and is.
Yes,
are you there, Sarah?
I am. Yeah, could anyone hear me? I'm so sorry. My internet completely just fell away, so I didn't even hear the question. I'm so sorry.
Don't worry. So we were asking, as a region, obviously there are a lot of challenges with inequalities and so on, and it was really about, what do you think the areas we could be potentially focusing on, where there are areas of opportunity for researchers in particular to get involved in that sort of aspect of work?
Yes, and I didn't hear Amy's response, but I think possibly Amy mentioned the consortium challenges that are coming up, and that we have the maternity consortium, for example. Yeah, that's really, yeah. So I think there's some really good opportunities where what the NIHR are now looking to do is get partnerships involved with people from different disciplines and specialties working together, which again fits with the 10-year plan ethos that we need to be working, into communities across disciplines. So I think there's certain things that will be coming down the pipeline, I think, in terms of where there's perhaps more network collaboration type spaces. Certainly from an evidence-based point of view, in terms of how to address inequalities, what is clear is that, cross-governmental strategy is needed and cross-working. So I think this sort of, and also I guess it feeds into that multiple long-term condition agenda, and also the government's focus at the moment around sort of workforce and productivity of the workforce, and sort of the economic angle to all of this health inequality as well is really key. So I think there's some really interesting spaces for people to develop that sort of cross-collaboration work, and I would see that being something that's encouraged, and I think we're well positioned in this region to be able to support into that agenda as well.
Thank you. I think that's a really good point. There's a need and there's an opportunity here, and that's a great point. I'm not seeing many questions in the chat yet. Oh, hang on, Martin, got a hand coming up there. You're muted, Martin.
Sorry, just very quickly to say that NIHR launched one of their theme calls last week, I think, and that's around shaping the support and health, public health and social care workforce for the future. And there's a focus on health inequalities as part of that as well. So that's something they do periodically. So there will be opportunities, I think, to exploit in that as well.
Okay, no, thank you, Martin. I think that's very useful to know. So just in the last minute or so, maybe I'll ask Amy first and then Sarah, if you had one piece of advice. Your way on. Eunice has popped her hand up. Eunice, fire away.
Yeah, thank you so much for the presentation. I'm just quite worried about methodologists and opportunities that are available in NIHR for methodologists. Are there particular methodologies that are looking to advance? If there are, what are they, and where do we lack in terms of Northeast, the methods that we have in terms of public health research? Yeah.
Amy, I don't know if you want to take that one first of all.
I'll take it first and then hand over to Sarah about the public health methodologies. So, Eunice, there are huge opportunities for methodologists, and they are funded by NHR, and you are a key profession that they want to support, and can often come under the grouping of underserved professions, which is means it's quite a target for NIHR. As a methodologist, you are able to apply to all of the mainstream personal awards, which includes pre-doctoral support, doctoral support, and postdoctoral support. So the funding streams are there and available. I don't know if you want to say more from a public health side of things.
Yeah, I guess to echo what Amy's saying, it is recognised as a really important skill set by the NHR. So they do have sort of schemes and things where that is a methodologies in of itself is a category that is frequently underrepresented, and they want to encourage. From a public health point of view, and speaking specifically from the Research Support Service Specialist Centre for Public Health, the research design advice arm of that work employs quite a number of methodologists, and we're always looking about kind of the skill set that's involved there. So we obviously work across a very applied mixed methods researchers. So we have health economists, qualitative researchers, quantitative researchers, epidemiologists, but we're also looking at that sort of microeconomic, quasi-experimental areas, and also that sort of area of co-design work and community engagement and participation. So we're always sort of on the radar, I guess, around what are the emerging methodologies that are going to really be answering those challenging questions that we need to address for the health of the nation, and have we got the methodological fit right? And in that is the sort of comes into the training and development element as well. So there is an offering of training and development put on through the specialist centres, and some of those things are in methodology, for example, you know, complex design and network analysis, things like that. So it's a really exciting area actually, because I think that sort of embracing those wider methodologies is really goes again into that thing about working cross-disciplinary. It's the same for methodological development as it is for sort of disciplines of,